So it's not. He said that he got out of here, he can't talk about her. Crazy. So he said he would participate, but he may be a little late, so but he may join online. I will. Let me add it, probably. The star on university said yes. So yes, we started. That's what they is. And then if he joins remotely, he wouldn't be able to. No, we have one on the agenda. Oh, it says directed for. No, I thought. So I think we go over and well, the average of the temporal position.
Jeff, do we need to make any amendments to the agenda to rectify this thing? No. Are we good?
On the agenda, that has address for the result, but there was a chance to do it. So
Yes, to it. All right.
Well, then we're going to go ahead and get started. Welcome everyone to our very first meeting of the year and a very exciting one. So we'll call this meeting to order at 4:02. Can we please go ahead and have a roll call?
Roberts, here, Director Hills, here, Director Bob, Secretary Laura, President, Vice President Rodriguez, and Rob.
Here, can you please join me for the Pledge of Allegiance? It'll be on the screen. Your heart, ready, begin. I pledge allegiance to the United States Thank you. This time we need to approve the agenda, but we do need to make a correction. Do I have a motion to do?
I'll move to amend the agenda to change Director Shore's names to Director Logston's.
Okay, we have a motion and a second. All those in favor, yes.
Is that means Director Lawson is not going to join us out?
My understanding is that he will be joining us remotely, virtually, which is not his name. So we have a motion, a second. Does it need to be a roll call? No, or can it be? Okay, can we go ahead and have a roll call?
Robert, yeah, yes. Secretary Laura, yes. Vice President Rodriguez,
Yes.
Yes. So then we move forward, right? Or do we now have to approve the full agenda? Or was that just the approval with the correction?
Move approval of the agenda.
Second.
All those in favor say aye. See no opposition, we're going to move forward to public comments. That's item D. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed in the agenda. Public input may be offered on agenda items when they come for discussion and/or action. Do we have any public comments? Perfect, thank you. Then we're gonna go ahead and move on to item E, new board member appointment interviews. Staff going to introduce the item first, or should I just move on and read the?
Interview process, great.
Perfect.
Let's read that.
Okay, perfect. Thank you. So we do have, I'll go ahead and read the interview process and then the nomination process. So first off, I would like to thank everyone for attending today. The board will now consider nomination for board member from Zone 5, and I will go over the ground rules. The order of the candidates will be in alphabetical order that has been made public already. While this is an open meeting and each of the candidates are free to watch other applicants as they are interviewed, to ensure that the process is fair, the board asks that as a courtesy to the other applicants, that the applicants who are not being interviewed wait in a separate area until called. Mr. Espinosa, over here, will escort the candidates to and from the separate area when it's his or her turn. We, the board members, have reviewed each of the applications, and each member will have the opportunity to ask questions of each candidate. At the conclusion of all the interviews, the candidates will be asked to return to the meeting room, and it will be opened up for public comment and board discussion. Following board discussion, the nomination and voting process will begin. Let me ask yourself what the nomination process is. Don't worry, I got you. So the nomination process.
Excuse me, Director Lofsky.
Okay, so for the record, Director Lawson has joined us virtually. Thank you. Hello, welcome.
Hi.
So the nomination process. At the end of the interview process, following board discussion, I will announce that nominations for appointment to the board are open. So more than one person may be nominated. Nominations shall remain open until all nominations are made by the board members. To ensure that all potential nominators are provided an equal opportunity, I will ask, are there any other nominations? When there are no further nominations, I will indicate that the nominations are closed. Mr. Christensen will distribute individual ballots, and each of the board members will write their selection. In keeping with the requirement of transparency and open voting, the completed ballots will be handed back to Mr. Christensen, whereupon the voted selection of each board member will be read out loud. The paper ballot method will be utilized on the first and any subsequent ballots until one of the nominated candidates obtains at least 4 votes. When one of the candidates achieves 4 votes, I will ask for I will ask for a motion and second on the appointment resolution and for roll call vote. After the resolution is announced, Mr. Scott, our legal counsel, will administer the oath of office to our new director, and then we'll call it a night afterwards. We'll go celebrate, have dinner. And then, as you can see, we have an open seat. So visualize it, envision it, that's where you'll go. At this moment, do we open for public comment on this item? Is that, or do we just move?
Public comment.
Okay.
Related to the item on the agenda.
Okay. So then we are gonna go ahead and proceed and start the interviews. Okay. So we, at this time, if we get, yes,
So if this item that says number 3, public comment, is not actually acted on right now, when does it become?
If you notice, we introductory comments, then the board introduces each of the applicants, and basically then public comment, if there's anybody, I don't expect this, but there's a requirement that we have that.
but what I will do before we excuse the candidates, I will ask the board members if you have any questions regarding the process. No? then let's go ahead and get this started. So first, if I'm not mistaken, if I have my list correct, is Len Foster. Okay, and if we can have, Mr. Espinosa, if you can please escort.
And the public starters.
Board members, are we ready? Okay. So once again, Mr. Foster, thank you for your interest in applying to this board and serving on this board. So we have a set of six questions, one per each current board member. So what we're gonna do is we're gonna allow you 3 minutes before we start with the questions for you to introduce yourself and let us know why you'd like to serve on the board. And so if we're ready, the mic's all yours.
Thank you. My name is Len Foster, and I've been a resident of this area, this community for the last almost 8 years. I moved from Monterey. I have about 35 years of public health experience. I was the interim director of public health in Orange County. I was the director of public health department in Monterey County for about 10 years. I retired in 2010. And we moved to the desert about 10 years later, and been doing some volunteer work, and I decided that this was an opportunity that might be able to take advantage of my experience and expertise. And that's why I'm here.
Perfect, thank you. And if you can please address your answers to the board, that would be good.
Good evening. Again, thanks for applying. So our first question is, if you basically describe a little bit the experience or background that specifically qualifies you to serve on the health district board.
I'd be happy to. So I indicated I served in Orange County in various aspects of public health for about 25 years. I started out my first role with director of animal control of all things. I finished as the deputy director of public health. I was recruited for the position of health director in Monterey County, which I took in 2000, and served in that position for about 10 years. And during that time, I think I've been able to experience all aspects of local community health. And I think I have some direct experience and some expertise to be able to add to the collective experience of this board in your pursuit of wellness and optimal health in this community. And this is a community that I call home. This is a community I plan to stay for the rest of my life. As a matter of fact, I have purchased a retirement property in Cathedral City called Qualis Cemetery. Actually, that's my next move. I have, in terms of education, I have a bachelor's degree and a master's degree in public health, public administration, excuse me. And I've served on a number of boards and commissions during my approximately 35 years of public health experience.
Thank you for that, and thank you for applying for the position. My question is, do you have any special expertise that you believe would be especially valuable as a member of this board? Like, do you have any special powers?
I wish I had special powers. In terms of expertise, other than my experience, work experience, I think that my grounding in public health philosophy and things like the determinants of health. What are the things that really affect local community health? I know what those are. I understand core public health tenets. And so I think that having that particular intellectual background as well as experience provides me with somewhat of a unique set of skills and experiences and knowledge to be able to add to what is already existing on the board.
My question is.
It's just because I'm part of it.
Here we go. Can you hear me better?
Yeah, okay.
Have you served on any other boards? And if so, please share with us your experience.
I've served on a number of boards, probably the one that would be most compatible and comparable to what this board is the Central Coast Alliance for Health, which is the Medicare, excuse me, the Medi-Cal contractor for Monterey, Santa Cruz, and San Benito County. I was, as director of health, I was a member of that, appointed to that particular commission and served there for, I think, about 7 years. I also served on a number of national boards, including probably some of you have not heard of, one called City Match, which is maternal and child health orientation. It was a national organization, and it was centered out of the University of Nebraska at Omaha. And I served on a number of voluntary organizations as well. I'm a board member, and I served as the president of the literacy campaign in Monterey County, which I established after I retired. And that's probably about it.
Thank you. Director Luxon?
Got it. Hey, thank you for making the time. Sorry I couldn't be there. I'm the only surgeon in town. My partner's out, so I just couldn't be there tonight. But I appreciate you making the time to come in. My question's around really your understanding of the healthcare board. I know you've worked in the healthcare field for quite some time, especially in an administrative role. But when it comes to really understanding the roles and duties of a healthcare district board, what's your understanding of those, and what has your involvement been with healthcare districts in the past?
That's a difficult question. I'm not sure I understood it entirely, but I think you're asking me what I think the role would be for what my experience is related to the particular.
I'll clarify. So two things. What's your understanding of the roles and duties of the healthcare board member? And then my second add-on question was, because seeing that you've had a lot of healthcare administrative experience, have you ever interacted with a healthcare district board before in California?
With the healthcare, I didn't understand the last part of your question.
We'll repeat it. So question is, what is your understanding of the role and duties of a healthcare district board? And what is your experience in working with healthcare districts?
Okay, first part is I understand the role of the healthcare district is to optimize the health of the community in all phases of life. And you do that from a variety of ways, including contracting with local organizations, directly managing lease for the hospital, and a whole variety of other aspects you do as a part of the foundation. You do funding to community organizations, and I understand that part of it. I have not served in that particular role before, although I think as I indicated before, I think my experience and expertise in public health administration, public health systems provides me with some expertise, which is additive to what the board already has among your members. And so I'm hoping that this is a value that I can bring to the board, and let's let it go with that.
Perfect, thank you for your answer. The next question is, so over the next 30 years, the district will receive $650 million in lease revenues from tenant healthcare. What is your view of the priorities of how the funds should be used to advance healthcare in the Coachella Valley?
I'm sure glad for all the questions. Because I think this is a unique opportunity for this board and this community. This is an incredible amount of money and an incredible responsibility. And I know the board is working on a updated need assessment of our community, and that's important. I go back to my foundation in public health and determinants of health. And determinants of health are genetic, which we can't do much about at this point in time, although it's evolving. Things like nutrition, behavior, environmental conditions. Medical care, in my opinion, is a support function. It's not one of the determinants of health. So I believe that this board has an opportunity to use this next generation, this next 30 years, to basically prepare this community, prepare the generation that's coming up to be the healthiest generation this community has ever seen. You do that, in my opinion, by dealing with nutritional deficits. I'm not just talking about people who are at risk of not having enough to eat. I'm also talking about people who are saddled with a diet that is not nutritious. We know that behavioral aspects, the way you drive, the use of firearms, the lack of exercise are all important aspects to predict how you're going to be, whether you're going to be healthy or not. And so I think that this board has an opportunity to start to address some of those things, sometimes directly through funding, sometimes through policy development issues with governmental organizations that are charged with things like, how do we deal with the pollution that we're seeing coming off of Salton Sea? How do we deal with the issues of water quality? We've talked about issues of lead contamination in local water. There are other kinds of contaminants that are contained in water which directly affect the health of individuals. So I think this board has an opportunity to target funding into areas which are going to have fundamental changes in the health of the generation that's coming up. And this is a unique window that will never come again. And so I'm hoping that the board is going to make the right decisions.
Okay, thank you for coming in, for allowing us the opportunity to hear from you. Okay, so my question is, besides the services provided at the hospital, are there other areas of unmet healthcare needs in the community that you believe should be addressed by the district and foundation?
Yes, there are always going to be unmet healthcare needs. There are always going to be marginal populations that don't have access to quality healthcare. There are always going to be people who are not going to take advantage of resources as they exist. There are people who have transportation issues, people who have language issues. And I think it's incumbent upon this board and this community to take a look at through a needs assessment where those pockets are and to tailor responses appropriately to deal with it. Some of it can be population-based. Some of it can be through media campaigns that are more general, but you have to make sure that in addition to English language, we're also doing other languages which are well represented in our community. So I think it's not a very simple question. It's not a very simple issue to address, but I think that I think we're going to see that the issue of diabetes is going to be a huge issue in our community. It continues to be. Obesity is a continuing issue. Behavioral health issues are always out there. And I think even more so than physical health, behavioral health issues are are a challenge for a lot of reasons. People don't want to admit that they have those kinds of issues and want to accept those services. In other situations, regardless of the intent of federal government, healthcare coverage for behavioral health issues and addiction medicine is not simply the same. It's not equal. And I think that's a challenge to figure out how you can start to address those inequities.
Well, thank you for those answers. That was the last question. And so we're going to go ahead and excuse you, and then we'll call Mr. Gary Hans. Thank you.
Or, I'm sorry.
Yes.
Madam Chair, Madam President, I was wondering, should we give any last opportunity to have him ask any questions?
Thank you.
So, sorry, do you have any questions of us? Anything that we can clarify? No, okay. Thank you.
Excuse me.
Alejandro, Craig. Craig is next.
That's just before age. I'm sorry. No, your ass. Oh, sorry. Okay.
Right. Welcome. Hi again. So we have a set of 6 questions. That's going to be 1 question per director. Before we begin with the questions, we're going to allow you 2 minutes to introduce yourself and let us know why you'd like to serve on our board. And then towards the end of our questions, you'll have time to discuss any questions or, share anything that any closing comments. Please direct your answers to the board members. And if you need us to repeat a question, we'd be more than happy to do so. Okay. Alrighty, so then the floor is yours. Please introduce yourself, name, occupation, background, let us know why you'd like to serve.
Okay, thank you. Well, good afternoon, evening, and thank you for allowing me to be here. My name is Gary Hotz. I am occupation is retired right now. I spent 43 years in the healthcare industry in multiple roles. I am married, 3 children, live in Bermuda Dunes Country Club. I've been in the Valley for about 14 years and just recently retired as CEO of JFK Memorial Hospital. 43 years in healthcare field. So I started as studying criminal justice. I was going to be a VI agent, and I was working in a hospital going through my undergrad degree. I changed direction. I got into entry-level management. I worked my way through management through all various operational departments and ended up being the COO of that hospital. I started as a security officer, working my way through college. Went on to become a CEO. I got the reputation as a turnaround guy focused on operations, going into difficult hospitals and areas and helping to ensure their longevity and improving quality, financial and public relations in each of the markets that I was in. I would say that I am grounded in serving the community. My role in everything that I have done in serving the community. And so why do I want to be on the board? What attracts me to that? Since I retired, I've been trying to figure out how do I best give back to the community. And that this opportunity arose, and I decided this is where I'd like to spend my time. I've got unique qualifications and skill sets, both operationally and strategically, and growth. And so I'd like to put that to use in the healthcare district and bring that to the table. So that is who I am.
Thanks for applying, Gary. It's great to see you. It's been a long time.
You also.
So My question kind of goes off of what you just talked about, your basic experience and the long record in healthcare that you've had. How do you see that being benefit to the healthcare district board, especially as we're going through the strategic planning over this next year?
Well, I think my experience lends me to understanding what the needs of the community are. As the CEO of a hospital, no matter what community you're in, you have to understand the community and what the needs are, because your job is to serve the community. And if you bring a service to the community that's not needed, that's wasted resources. And so you really have to understand the needs. For example, in the East Valley, some 4 years ago, when I was there as the CEO, there was 200 vacancy of physicians in primary care alone. And that's not even talking about the specialties. So understanding that and where to focus your energy and resources to bring that access to the community. That's one of the things, many things that I bring to the table and is necessary in this role.
Thank you, Gary. Thank you for applying for this position as well. Do you have any special expertise that you believe would be especially valuable as a member of the board?
Well, I think my specialty expertise is my 43 years in hospital operations. I'm not just a suit who's a CEO who walks around the hospital. I came through operations. I came from the ground up, and I understand the operations of a hospital. I also understand, by knowing that, I also understand the community. I've been involved in community organizations, multiple, which is on my resume that hopefully you've reviewed. In that unique combination of understanding operations, going in as a CEO and understanding, evaluating what the community needs are, and to spend your time and resources and focus in bringing those services, multiple different services in East Valley, I was able to bring, and again, a lot of them are in my resume there. So I think that's my specialty skill set. It's a broad range of operations, success in growing an organization in trouble, bringing high quality care to a community, and developing public relations from a very negative public relation to a positive public relation atmosphere in the East Valley for JFK.
Thank you. Hello. My question for you is, have you served on any other boards? And if so, please share with us your experience with those.
Yes, I've served on multitude of boards, and I'd have to read them to remember all of them. In every community I've been in, I've served on local boards and also statewide boards. For example, Hospital Association, both in California and Nebraska. I've served in California. I served on the executive committee for the Hospital Association right at the time we were going through COVID, and very involved in helping to map out the response plan for COVID. Local boards, volunteers in medicine, cancer societies, and so on. So a lot of different local boards, and I'm very selective on the boards that I choose to spend my time because it has to have meaning of giving back to the community and making a difference.
Great. My turn. Gary, thank you for making the time to come out here. Really appreciate you applying for this position. I know you work in healthcare, so I'm going to ask you two questions. One is kind of a question we planned ahead of time, but seeing that you've worked in the Valley before, my first question is going to be, what do you think are the three most important healthcare changes we can do in the Valley? That's number one. And number two is, what's your understanding of the roles and duties of a healthcare board member?
So I'll answer the second one. The role is the oversight of the community's money to ensure that we're properly putting resources where it's needed in the community to improve the welfare of the community through health and fitness. Oversight of that is a large fiduciary responsibility to look at the hundreds of millions of dollars that are in there that you're responsible for and making sure it makes a difference in the community. So you have a strategic plan, is to oversight that strategic plan and implement that and tweak it when necessary to move forward. The things that I think are necessary in the valley. First and foremost, I think appropriate access throughout the valley for care. It's not just an issue here in the valley; it's throughout the United States. But right here in the different markets that I've worked at, it's more difficult here than any other market that I've worked in. I mentioned the deficit of 200 positions in the East Valley. That's just the East Valley, and that's just primary care. So understanding the appropriate areas for access, I think is number one. Number two, I think the Valley has embraced the notion that there is a behavioral health need in the Valley. I would say that when I came to the market in 2012, it's one of the things I saw, and I worked with local community organizations along with elected officials to start addressing the behavioral health. And today, I think it's known as the Green Ribbon Committee here with Supervisor Trist. Behavioral health is another one. And the third one, I think, is really the fiduciary responsibility of anyone asking for a grant, is to understand that ask and to understand how do we make sure that we get something in the community for that ask. And that means improving health in the community. So I think that's the three things that is a priority for this district.
Thank you for your answer. Next question. Over the next 30 years, the district will receive $650 million in lease revenues from Tenet Healthcare. What is your view of the priorities of how the funds should be used to advance healthcare in the Coachella Valley?
Well, first off, it's a lot of money. And I think I've mentioned that in some of my other answers. First, the top three priorities I talked about. But I think you also have to make sure that we have to keep referring to our strategic plan and follow that strategic plan. It's easy to get off direction when a hot topic comes up and we go down that road. We have to remind ourselves what our strategic plan is and to follow that. If the strategic plan has to be revised, then we do that and we address it appropriately. The other part of it is, and I'm very big on fiduciary responsibility, is when we say we're going to fund a grant or we say we're going to do something, we need to be able to measure that. We need to be able to say, what is the outcome? And maybe it's 6 months, maybe it's 2 years, maybe it's 5 years, but we need to be able to measure that. Because with $650 million, that's a lot of impact we can make in this community. And we need to make sure we're making the right positive impact.
Okay, Gary, I have two questions. One that is my assigned question, and my second one is related to your experience operating the major hospital in the Eastern Coachella Valley for so many years, and your understanding of the issues there. Okay, so starting with, besides the services provided at the hospital, are there other areas of unmet healthcare needs in the community that you believe should be addressed by the district? Okay, that's first question. Okay, the second question is, as the CEO of JFK for so many years, and your involvement with several nonprofits that have addressed with the unmet needs in the Eastern Coachella Valley, how would you approach the Eastern Coachella Valley's tremendous unmet needs? How would you just give me some insight as to your knowledge and how you would approach that?
Yeah, the first question again. Give me that first question again.
Besides the services provided at the hospital, are there other areas of unmet healthcare needs in the community that you believe should be addressed by the district?
I think the overriding education of access to care and what care means to the community, not just in East Valley, but the entire district. There are a lot of unknowns when people are out there and they now have to deal with a health issue and knowing where to go. Most of them do turn to emergency room, and that's a challenge because that backs up care for those that are in an emergency situation versus urgent versus primary care. But other than that, I think it's education across the board. And I don't think you can educate enough and communicate enough where access points are. And because you hear it once and that's good, but it doesn't retain. But we have to be out there continuously educating. And I think that's a big point. I think that's not just the district. I think that's all healthcare entities in the valley. So that's, I think, the number one. Number two, now I lost that question too.
Okay. So because of your tremendous experience in the Eastern Coachella Valley, running the hospital, JFK, for so many years, and also your participation in some leading nonprofits addressing some of the unmet needs in the Eastern Coachella Valley, this ties in.
Conversation about that. But first, it's the inventory. What are all the access points out there? And two, let's put our list of what are the needs, because we know what the needs are. Strategic plan identifies a lot of those needs. And so we need to be able to match those two together and to move forward and execute on that. I kind of, one of the things that didn't come up in the questions, and I failed to talk about it too in my intro, is I've been involved with 2 residency programs in Omaha Tree University. Over 120 residencies, along with fellowships and specialty programs. And so we need to be able to continue to nurture and grow those residency programs here, not only for access points, but for future growth and attracting those residents as they go through a program to stay here. So we don't have a revolving door with access and positions.
Thank you. At this time, we welcome any questions you might have from the board and any closing comments.
Sure. What surprises did any of you have when you first came on the board and you said, you know, we all have the intent of serving our community? What surprises did you have that you said, oh my goodness, I didn't realize that?
I'll open it to any of my board members.
I think it was the enormity of the responsibility. You know, as a registered nurse, you get your 6 patients a day, and then you realize that your patients are the entire community where you live, and being answerable to that.
Anybody else would like to add?
I think what surprised me the most is how often we all come from different backgrounds. We have different experiences, but how often we're able to reach consensus. And that surprised me. So, you know, I think being able to work well with one another allows us to be able to reach that. I think even though we may not agree at the end, but we reach consensus.
Any closing comments?
No, I'm good.
All righty, thank you. Then we're going to go ahead and excuse you, Mr. Espinosa, to escort you out. Yes. Next one. You too. So up next, we'll be interviewing Craig Johnson.
Thanks. Yeah, Mike in.
Craig, welcome once again. We will allow you, well, we have 6 questions for you, a set of 6 questions. Before we begin with the questions, we'll allow you 3 minutes to introduce yourself and let us know why you'd like to serve on the board. And then towards the end, we'll go ahead and give you some time to ask questions. discuss questions and then to provide additional like closing comments, right?
Good.
Okay, so then we're gonna go ahead and get started. The mic, the podium, the it's all yours. Yes.
Well, thank you for the opportunity. My name is Craig Johnson. I'm the Executive Director of Juneau County Service of the Desert. And it's really a pleasure to be here today. Quite honestly, when I saw the opportunity with the open spot, I immediately started thinking about who I knew that perhaps would be interested, who could do a good job. And I don't know what in the world possessed me to think that I could do something like this. Okay. I took a look at then the credentials of the other candidates, who are obviously very well credentialed with their experience, etc. I think, though, that put my mind at ease a bit. I am who I am. My experience is what it is. And I think I have a lot of connection with the community. I've been here since 1995. I've been a Zone 5 resident since 2000. I have a very good understanding of what services are available here in the community, what is needed, people are asking for. And so if my experience could then lend itself to the district's success, leading therefore to the community's improvement, that's why I'm here. So, then someone asked if this is an opportunity to pad my resume. Am I looking for someplace else to go? I'm very happy at JFS. So truly, this is an opportunity to do what I can to improve the operations of the district, to work on the strategic plan, to make our community better now and in the future, and to work with some really fine people whom I have tremendous respect for, both the board members and the staff itself. And so really, I appreciate the opportunity to hit me.
Thank you, Craig, for applying. I appreciate it. And never undersell yourself. You're doing a tremendous amount of work in this valley. Kind of going off your experience, if you could kind of highlight how your experience would benefit the healthcare district board in the community.
Yeah, no, good question. A lot of time in association management. It really comes from the coordinator to the manager to the director, now to the executive director. And so I believe my experience in creating programming and creating policies, now in things like I understand risk management is one of the responsibilities of the board, having to worry about things like risk management and as an executive director. So I've kind of been there and done that and done it all. And so I think my well-rounded perspective would lend itself to kind of any conversation that we're involved in as a further now in working with the associations, and it hasn't just been associations, but primarily associations. I have very strong connections with many service providers and many other entities around the Coachella Valley. And I think those then would serve the board if we needed to make contact with an individual, if we had questions for an individual. I wouldn't mind being that person making the outreach. Chances are I know that person. And generally, I hope, anyways, I have a very good relationship with that person. I don't know that I've burned too many bridges in the past, maybe with Alejandro here, but it's his fault. So my experience here in the Valley, as at the Eisenhower Medical Center for a number of years, it was with Stars Behavioral Health where they lost all their contracts, and now GFS for 11 years now. I think my passion for the work that we do as service providers, my appreciation and love for the Coachella Valley lends itself to serving the foundation and district. Well,
Thank you, and thank you for applying and for all your good work in the community. If you're selected as a board member, what do you think you can bring to the development of a successful long-term strategic plan?
question. I think again, it has to do with my experience as a service provider. What we're talking about is making sure that there is access to service for all Coachella Valley residents, access to high quality service, to services provided in the fashion that they want these services provided. And so I believe my knowledge of just those areas and interacting not only with my staff, but I've had many interactions with clients over the years. I think that then helps create a plan that delivers healthcare services in a fashion that needs to be delivered. Again, that it's effective, high quality, and delivered in a fashion that people want to receive it. No longer is it cookie cutter, one size fit all. We're going to tell you what you need. Now it's much more tailored services going into the community, asking them what they need, asking them how they want it, how best it will be received. And so I think, again, my experience helps to create that structure in all of our future plans.
Thank you. Have you served on any other boards? And if so, please share your experience with us.
Yeah, good. This would actually be, I've been on several steering committees. In fact, here I'm on the Behavioral Health Collective here, supported by the district and foundation. Several working steering committees, boards, etc. But this would be the first volunteer board, if you will, that's kind of outside my business needs, etc. So I don't know that I'm adequate to answer that question, but again, taking a look at the resume, many things have come up over the years. The Tay Collaborative for the county because I was in charge of the local transitional age youth programming. Again, for the Behavioral Health Collective because JFS, one of our services, is mental health. And so the boards and the steering committees I participated on have largely been connected to my job at the time. Well, yes, this is connected to what I do currently. This would be the first time that I'm stepping into a position that is not necessarily directly related to what I'm doing on a day-to-day basis. Hence my, and it's not apprehension, but really, again, looking at board members and your credentials and what you've done, I know I stand to learn a lot, and just hoping that what I have to offer be contributory to the goals of the district foundation.
Director Loxton?
Perfect. I was just waiting for my turn. So, again, I appreciate you making the time to come in here, share about yourself. You've done a lot based on your history, I think, in the community. And so I know you've served on some boards and you've participated in that way. So, what's your understanding of the role and duties of a healthcare district board member?
Yeah, good question. I appreciate that. Really, it's those things. It's fiduciary oversight, working on a strategic plan. Again, it would be working with the district staff on creating programming, the grant allocations and approvals, the risk management that I noted earlier in my comments, and then really looking at grant finding and or funding the foundation and the district's operations. So that is my understanding of what the responsibilities of the board members are. I'm sure I missed some.
No, I think that's good. I think it's mostly just getting an understanding of what you understand about how the board functions and how you kind of view the role of it. So I appreciate you sharing that.
Yeah, absolutely. And in taking a look at the committees that are currently available, honestly, I see myself as being helpful as it relates to the program committee and also the public and policy committee. I think those are my strengths. And I believe all of us that want to be involved in the strategic plan, which again, I'd be happy to participate.
So the next question is, over the next 30 years, the district will receive $650 million in these revenues from tenant healthcare. What is your view of the priorities of how the funds should be used to advance healthcare in the Coachella Valley?
Well, it's a fantastic question. Given that what we're seeing now is a tremendous growth here in the valley. And I know it's primarily East Valley, but it's everywhere. That also then is the need for the provision of healthcare services. So I think we need at least one more hospital, and I don't know necessarily where the hospital should be located. I appreciate the fact that the district supports the mobile units that get out to the rural communities. I think that's important. I think we need to continue to look at the advancement of telecare services, despite, I think, some threats of removing telecare. I think if nothing else, the pandemic really helped solidify the fact that we need telecare services. Many people, especially those who live remotely, it is their only access to care. And then I think lastly is whether it be more collaborations between service providers so that we're making sure. I think the government does a good job in creating broad programming. I think associations do a very good job of catching people who fall through those cracks. And so developing some additional collaborations with local agencies to help expand their services, again, to make sure that everyone is providing with needed services.
Thank you for submitting your application. Okay, so I have two questions. One is my assigned question. And then second one, I will first, if we could address the first one, that way you can give your full attention to that one first. Besides the services provided at the hospital, are there other areas of unmet healthcare needs in the community that you believe should be addressed by the district? Okay, so that's the first question. Do you want me to say the second one? Because it's kind of related to.
No, I won't.
Okay, go ahead.
Well, I could be a little biased here, but honestly, I think what we need and what we're seeing is an explosion of mental health concerns. And I think what we also understand is that mental health, at least in my opinion, is oftentimes more difficult to diagnose than physical medicine concerns, physical health concerns. And so really, I think the need for increased services in behavioral health is absolutely necessary. We're seeing now tremendous increases in referrals for services, for instance, in kids. Our youngest client is 5 years old. So, and I know that we can, at this point, we can't handle all the referrals we're receiving. I don't know that any provider is able to handle all the referrals that they're seeing. So I think we really need to focus on the provision of additional behavioral health services. Additionally, I think we need to focus on developing the next generation of providers. We have a hard time finding licensed staff, and perhaps it's because we're an association or a nonprofit and we struggle to compete with the salary compensation that we can offer. But I think what we find throughout the Coachella Valley is the lack of necessary service providers. I'm not quite sure what that is. It's a beautiful place to live, and I think the lifestyle is fantastic. But we need to figure out a way to attract more service providers, providing additional training locally, have them fall in love with the Coachella Valley so that when they're done with their learning, done with their education, they take their practice here in the Valley. So behavioral health is, I believe, number one. Also, I think we're starting to see a little bit of it as it relates to early childhood education and nutrition, physical, athletics, physical education, getting the kids out, getting them off the computer, getting them off the gaming systems, and getting them back out. So really, I have a propensity to lean toward additional behavioral health services, additional support for the kids. And again, if we have additional support for the kids and help set them on a path that is better for them physically, mentally, emotionally, the community will improve over time.
So this second question relates to the unmet needs, and we've addressed the overall Coachella Valley. Okay, so my second question is because of the fact that you do have tremendous experience in the entire Coachella Valley and in the Eastern Coachella Valley, you have, the issues. So with your day job and your participation in some of the committees that you've been involved in, can you share with me how you would address the unmet needs in the Eastern Coachella Valley?
I think that's a very good question. And honestly, I think it involves a continued conversation with residents and leaders of that area. I think for too long, we and others have come in and told them what they need, told them how they're going to get it, told them what's available, and this is good. Be happy with what you're going to get. So, and I think we've improved. I think as a community, we've improved recently as far as having those conversations and having a dialogue that leads to improved services. It needs to improve. It certainly needs to continue. And so I'm not the one to come in here and say this is what they need. I think though I'm the one to say we need to have the conversation with you, ongoing conversation. What do you need? How do you want us to provide it to you? And not just speaking with the leaders, getting out in the community. And so that involves trust. I think there continues to be, and unfortunately, a growing mistrust of government entities in that area. And so we need those leaders, we need those advocates. We need to, over time, establish and maintain that trust with Eastern Coachella Valley residents and leaders. I think that will lead to great improvements in that area.
Perfect. Thank you for your answers at this time. Welcome any questions and closing comments you might have.
Just a couple of questions. In reviewing the foundation's budget, it looked like there is a good amount of money that comes in via grant support to the foundation, but I didn't see anywhere the source of those grants. Is there generally, are these federal grants? Are these private foundation grants?
Chris, would you like to answer? Right.
And it was under the foundation's budget, not the district's budget.
You mean our directors can't answer? At the.
Yeah.
So the grants that are listed in the foundation are actually directed from the district primarily. There are some that we have received from the federal government, but primarily it's district that we just restricted for that.
Very good, thank you. Does the association does the Association of California Healthcare Districts control any of the district's actions?
No.
Okay, so we're an independent group, and
Yes.
so they provide guidance when needed, structure if we're looking for some structure, but they don't have any say as to what the district and foundation does. Okay.
State statute does though.
Sorry,
State statute does.
okay. It sounds as there is three.
And the foundation has received some big donations from other trusts that people have left for us. For instance, our environmental air quality program.
Very good. Thank you. Those were in reviewing everything that I found on the site, et cetera. Those are the only two questions that I had, and appreciate the opportunity to ask them.
All right. Well, thank you then. If you, this time we're going to go ahead and excuse you, and then we're going to call Anise Smith.
Thank you very much.
Afternoon, everybody.
I welcome again and thank you once again for your interest in serving on the board here with us. So we have a set of questions for you. It'll be one or maybe two from board members. But before we do that, we're going to go ahead and give you 3 minutes to introduce yourself and to let us know why you'd like to be on the board or join the board. And then towards the end, we're going to give you some time to, if you have any questions for us, we'll go ahead and take those and then for closing comments. All right. All right. Then if you can please go ahead and get started and introduce yourself. Yes.
Is there a timer? You can give it
Yes.
10 seconds and go on and on. Awesome. So thank you and good afternoon. My name is Anise Smith, and I have lived in the Coachella Valley now for over 12 years. I am a Palm Desert resident, and my background here really started with me moving to the desert, and I was a client of the Coachella Valley Rescue Mission. I was in the Gateway program for 6 months. And after leaving that program, went to supportive housing for about 2 years after that. And so my lived experience with being unhoused, with being justice impacted, really is what fueled me to continue the work that I do today. And so background professionally, I am formerly the housing manager at the Coachella Valley Rescue Mission, and then I went on to work at the Coachella Valley Association of Governments, where I managed the CV Housing First program for 2 years. And that was before I went on to where I work now, which is still in the nonprofit area. But I work for a nonprofit called Starting Over Inc. We are based out of Riverside, but we do work countywide. And my focus, I'm a staff attorney there. And so my focus is mostly reentry services at this time, working with individuals coming home, individuals who are unhoused, helping them clean up their record, get connected to services, and advance forward in their lives. And so for me, it's very personal, just based off my lived experience, providing services to the most vulnerable in our communities. And I believe that the mission of the Desert Healthcare District and Foundation of providing optimal health, promoting optimal health for individuals at all stages of life really speaks to me, because I also think at all stages of life, but also in all circumstances of life that people can find themselves in. And so I know very often in my work, I am assisting people who are at very difficult points in their life. And so I appreciate the opportunity to do that, but also the importance of our nonprofits and our government agencies who are doing this very important work for communities that are often overlooked. And so the mission here of the Desert Healthcare District and Foundation is one that I very much support and believe in. And I believe that my experience, not only in the nonprofit world, but also working in government agencies. And also, I used to be on the Board of Governance for the Riverside County Continuum of Care for several years. Could be beneficial to this board. And so I look forward to the opportunity to share more with you about that. Answer any questions. Thank you.
Thanks, Denise, for applying. Appreciate it very much. You talked a little bit about the experience. If you could dive in a little bit more about how you think it would be relevant to a position on the healthcare district board, specifically when it comes to fiduciary management or strategic planning, which we're going through now.
Sure, yeah. So I did see that you all are going through your strategic planning at this moment. And so I guess it's maybe the season for strategic plans because I've just gone through a couple of those with organizations that I'm a part of. One is on the board, Planned Parenthood of the Pacific Southwest. We just finished our strategic plan as well as the Regional Access Project RAT Foundation, which I'm also on board. And we also had that meeting. And so recently, I've been doing a lot of that kind of work, interestingly enough. But how that ties to, I guess, my experience, the Coachella Valley Rescue Mission, we were managing grants, very large grants for housing, for outreach services, navigation, you name it. And so those were all public dollars. And we were very, very intent on making sure that in the management and spending of public dollars that we were being good stewards of those dollars. And so I think that's extremely important because this is a public agency and this is public money. And so that was really my first kind of foray into that, managing grants, even though at a nonprofit, but then going on to CVAG, of course, where those were all public dollars. Again, we were very intent on making sure that everything that we spent, we made sure we had measurable goals, outcomes, that we were tracking exactly what was going on. So we knew what worked and what didn't. And we had a lot of success, I would say, in that area, finding out how we were actually best impacting, making an impact in the community that would have a positive outcome, but also being willing to look at the data and say, this is not working. We love this. This is great, but it's not working. It's not giving us the results that we want. And so we're going to back off of that and stick with things that are actually showing positive outcomes.
Thank you, Anise, and thank you for applying for the position. If you're selected as a board member, what do you think you can bring to the development of a successful long-term strategic plan?
Well, one thing I think I can bring with my background, particularly for as far as collaboration, supporting programs that also involve collaboration amongst different agencies, different groups. One program that occurs to me that we had while we were at CVAG involved the mobile access unit, the MAC, I used to call it, the van that we had. And that was done, those outreach programs were done in conjunction with the Cal State San Bernardino Street Nursing Program under Dr. Diane Vines, as well as Inland County Legal Services. And we used to come monthly to Palm Springs, work in a parking lot, and provide all those services. And it was really during that process where I realized that we can do better work. We can make a stronger impact when we're working together, because we understand that, you know, when people are unhoused or they're disadvantaged in some way socioeconomically, that having access to various things is better than maybe just having access to one thing. And we're all helping the same population, but in our own specialized ways. So I think that experience with the mobile vehicle, I know you guys have one too. And so I think that was great, because to be able to provide also legal services, which of course I kind of tended toward, because very often that's overlooked in the provision of services. And it's just because there aren't a lot of us doing it. but I think it is something that is, you know, important to realize when we're working with folks and we're talking about health, we're talking about a holistic approach that many folks also have legal issues. Not always criminal, it could be family, it could be a number of different things. But if that's another area that's not getting assistance, while these other things are, it impacts the overall favorable outcome for that individual. And so the importance of collaboration and working together is something that I think I can bring to this process based off my experience. And then also being a service provider, but then also being a person who receives services for some time. I've been on both sides, you know, of that island. So I understand, you know, the importance of lived experience in these conversations.
Hello.
My question is, well, we already know that you're about other boards, but your experience on those other boards, how do you think they would help?
Well, my experience on those boards, let's see. So the Riverside County Board of Governance Continuum of Care was a wonderful experience for me. I think that was probably one of my first boards that I got onto. I was the formerly unhoused representative. And so, of course, we were dealing with federal dollars, state dollars, everything that comes into the county for our unhoused community. And so I really got to learn from my colleagues, listen and kind of see how these processes work when you're talking about public dollars in that way and voting on, you know, which agencies are these dollars going to go to? What are the outcomes from them getting those dollars? You know, are we improving our numbers? Are they staying the same? Are they getting worse? And so I think that just that experience of working collaboratively, but also working with the budgets, because I think that was something I didn't have a ton of familiarity with before that experience. And then now, as I said, between the RAP Foundation as well as Planned Parenthood, I've gotten a lot more experience with looking at budgets and understanding them. Wouldn't say I'm anybody's expert, but in understanding them and really making a plan for where it is that we want to go, which is the idea of the strategic plan, I think, but also making sure to focus on the mission, always with the North Star, what the mission is, which I understand to be here, promoting optimal health for individuals at all stages of life.
Anise, thank you for taking the time out of your day to come in and join us. I think we've asked some questions. I've asked some questions about your prior board experience, and this board, as you know, you served on multiple other boards. They all have kind of a unique role, and I'm sure you've lived in the area for a while. I think you ran for city council in Palm Desert too, so you've been very well connected to, I think, the community here. What's your view of the role of a healthcare district board member representing Zone 5? You know, how would you represent them? And then how do you really view your overall role working with the other board members and then promoting, you know, healthcare in this community?
I would say that in Zone 5, really understanding what the needs are there. And I think you all already have your strategic plan, your previous strategic plan, I think from 2021 that had your 7 goals. And so really making sure with the emphasis on the goals that you all prioritized, which I think were, it's a lot of information in my head. Oh, access to primary and specialty care and access to mental health and behavioral health, as well as focus on environmental factors and those impacts being air and water. And so all of those things that you all prioritized, I think you prioritized them for the entire district, but certainly in Zone 5, there's going to be some impact there as well in those particular areas. And so I think particularly you mentioned that I ran for office before. So that experience with actually getting in the community and talking to people and listening, I think is something I enjoy doing. It's not everybody's favorite thing, but it was something I thoroughly enjoyed, which was actually connecting with the community and listening to what they had to say. And one thing I'll bring up that it surprised me at the time, I heard a lot of from folks when I would knock on their door. They said, well, what are we going to do about this doctor shortage? I said, well, tell me more about that. What's going on? Mostly older residents. And they tell me, well, you know, I'm having a horrible time finding a doctor. I have to wait months, or I have to go out of town. And I heard it again and again. And I thought, this is a fascinating, bit of information, because I did not know. And so I think it's that process of getting into the community, listening to community members, and hopefully seeing how that can align with the data that we're receiving, because I think that these decisions have to be data driven and backed, but not just data driven, also incorporating what is learned from the community in that process. So that's what I would hope to bring to Zone 5.
Thank you for that. So the
Thank
next
you.
question is, over the next 30 years, the district will receive $650 million in lease revenues from Tenet Healthcare. What is your view of the priorities of how the funds should be used to advance healthcare throughout the Coachella Valley?
I think, well, a little similarly to what I just said, that the views will align with the strategic plan. We'll come up with measurable goals, and we'll track the outcomes over time with the results-based accountability tool. I could not keep that in my head. Results-based accountability tool, which I did take a look at, and I think it's a very impressive tool. But I think it's one way to track exactly that the outcomes are what was expected. And so over the next 30 years, I think you'll do a number more, I imagine, strategic plans, but certainly to start, focusing on the mission and whatever the goals are, and then whatever the priorities are set from those goals, but also being prepared to respond in case of events of, I would say, health emergencies, God forbid, whether or not a pandemic or something along those lines happens. I imagine the district wants to stay very available to be able to respond to those things as they occur.
Thank you, Anise, for replying. Okay, so I have two parts to my question. First part, do you want me to just say the first part and then second? Okay, so the first part is, besides services provided at the hospital, are there other areas of unmet healthcare needs in the community that you believe should be addressed by the district?
Feel like okay, again, it's similar to what I said, but unmet needs, I think you all already know behavioral health. We have to, it's so important to increase the amount of services that people that are available to people, but also how are people accessing it? How do people access these services? How do they enroll? How do they find out about it in the first place? And I know these are all things that you all have looked at. But I would also say, and I know it's in there too, about increasing telehealth opportunities because we're in an environment that's changing very quickly. And unfortunately, we have a segment of our community who does not feel safe anymore due to federal enforcement actions. And I have a family member of mine who works at a clinic in Coachella. And I know on days where there are actions happening that on an average day, they might have over 30 patients. And on those days, once the word gets around, nobody comes in. And so if people aren't taking care of their health and are too afraid to go outside and take care of the things that they need to take care of, what are those impacts? And so I think just in responding to the current times of what's happening, that could be a focus, which is to expand opportunities for folks, and then particularly in non-traditional ways during non-traditional hours, more into the evening or perhaps early morning before folks go to work, just to make sure that everybody can access the services that are being provided.
Okay, you've actually touched a lot of the things that I was curious about, but I will ask it anyways to see. My follow-up question is: you've addressed the unmet needs for the entire Coachella Valley. Now I want to know, how would you address the unmet needs in the Eastern Coachella Valley? And I'm asking you this question because of your experience, your knowledge working with CVAG and the other organizations, that expertise, that knowledge that you have in the Eastern Coachella Valley, and also your lived experience. How would you address the unmet needs in the Eastern Coachella Valley?
Well, one way, establishing a presence. So when we were doing the the mobile access center and some of our other clinics that we would hold, whether it be, the legal clinic, outreach, whatever it be. It was very important to me that when we held these clinics, we held them on the same day, at the same time, and that we reliably showed up. If this mobile vehicle is broken down, we are still going to show up and provide these services a different way. Because I think establishing presence and trust in the community, I found particularly out in that part of the valley is extremely important. And there have been times, for example, not necessarily health related, but I had set up an expungement clinic in Coachella. And I'm so excited because, we had been wanting to do this and we brought it out there and nobody signed up. And I thought, this is the strangest thing. So, of course, in making more inquiries and trying to find out what happened, I said, well, they don't know your organization. And this is not something, you're talking about people's backgrounds and things. They're not comfortable enough with you to show up and put themselves out there in that way. So, the importance of cultural competency, but also really being in the community. And so some ideas at that point that we had come up with was maybe to do some canvassing with some handouts that we could leave with people to introduce ourselves, partnering with organizations that are already there to share what it is that we're doing and ask them, what is the best way? How are you connecting with people? Because that's often the way to build trust in the community and presence is to work alongside those who are already doing that work there. So I think that would probably be how I would go about that.
Thank you, Amos, for your responses. At this time, we welcome any questions you might have of us and closing comments.
Just a quick question. So you're in the midst right now of your strategic planning, and very quickly, how is this year's strategic plan different in your view than the strategic planning you were doing 5 years ago?
That's a great question. Who would like to answer?
I can chime in if you want.
Yeah, go ahead, Director Dodson.
Sure. I think the biggest thing here that's a little different than the past is that the vision we're casting is going to be a lot larger. And I think a lot of that has to go is following the fact that Measure AA was passed last year. And with that action having been taken by the community, that's a big driving force to begin to think about how we reallocate these funds and how we reinvest in a large way into our community. So this strategic planning, while we always take time to understand our community and the needs, the vision that we're thinking about is not always just 5 years, it's 10, 15, 20 years, because what's coming into the healthcare district over the next 20 years is a significant sum of money. And so it's about how do we appropriately set the foundation for something this big. And so I think that's probably the biggest thing that I don't want to speak for all the board members, but hearing their comments from other meetings, I think we all realize the significance of what happened with Measure AA, and that we have a duty to make sure that we are really casting that vision for our community to bring them into the healthcare future for the next few decades.
Anybody else would like to add anything to that?
Thank you.
Any other comments?
Other questions? Thank you so much for this opportunity. Thank you.
Yes. So up next is Diane Weiss.
Hi there. I know most of you already.
Well, once again, we welcome you. We'll give our board member time to return to her seat. So what we're gonna do, we have a set of questions for you. Before we get those started, we're gonna go ahead and give you 3 minutes to introduce yourself and let us know why you'd like to join the Desert Healthcare District and Foundation Board. And then towards the end, or at the end, we're gonna go ahead and provide you time for any questions you might have of us and for closing comments. And if you can please, before we do the call, when you go ahead and answer, if you can please address the board.
Okay, yes, thank you for including me and inviting me to participate. I am a healthcare leader, an educator, and a nurse. And I have been a vice chancellor assistant, a vice president, a dean and professor, and a director of nursing. I'm also a counselor and a consultant to many of the organizations here in the desert. I am a former White House fellow and was a director of nursing at Boston Children's Hospital along the way. I'm a experienced public governance and fiduciary oversight. So I am actually anxious to bring those skills to the board, and I'm basically an ethical, mission-driven public servant.
Thanks, Diane, for applying. Appreciate it very much. And thanks for everything you do in the Valley. You talked a little bit about your experience. If you could get a little more examples of how that experience you feel would benefit the district as well.
Sure. One of the experiences that I think would be most interesting is I was one of three delegates to commissioners for the Western Interstate Commission for Higher Education. And so all of the Western states, the governors appoint three commissioners. I was actually elected chair of that commission, and I helped to start the Western Governors University. At the same time, I was a consultant to the governor of California at the time, and he wanted to do his own virtual university. So I worked with him to design the California Virtual University and did all of the work with all of the academic senates for the California State University, the University of California, and the community college system. We had extensive work with Western Governors University creation, but also we did all of the work for the Western Education Exchange, the Compact. So that, and with the Compact, the students in those states that are represented in the Western Compact, they can go to another state and pay only in-state insurance tuition. So that was an extremely important role. One of the other things that I think talk a little bit about is the Nursing Street Medicine program here in the desert. And I think my experience there would be valuable because I've worked with partners all over the desert and bring that we do vital signs and wound care, and we give out hygiene products, and we make referrals, we do health education, medication management for the homeless and vulnerable populations. And in that, one of your board members was actually the catalyst that started that, and we started it from scratch with two donors, and Nurse Rogers and I, and we built it to now we do 1,500 visits a year. So we've got a great deal of grant support, and we determined to provide give empathy to the nurses in the desert who because what we do is our foot wash program is the foot soap program we've been able to replicate it all over the country, and Fort Lauderdale, Bellevue, Mayo Clinic. It's the foot soap program is the student sits in a chair and in a low stool, and the homeless person sits in a chair so there's a power differential from the start, and they soak their feet in mineral salts and essential oils for 15 minutes. And they look the homeless person in the eye. They ask them their name, call them by name, and they ask them about their life. And we have seen people cry through that whole process because nobody does that. But we've done this all over the desert, all over the Valley, and really, we have 60 clinics in this just this fall semester. So I think I've had experience all over the desert in providing healthcare. The other thing we've done is we've created a collaborative of Doug Marin of Volunteers in Medicine, and I co-founder, and I now convene in Jarrett. A collaborative, it's called the Coachella Valley Street Outreach Collaborative. It's a group of 45 organizations that provide some kind of street outreach to the homeless and migrant workers and people like that, vulnerable, elderly. And that we've now created a website where we have all of the scheduled events for street outreach in the whole desert. And we have on a calendar where each of the organizations can actually get on and look and see who else is going out and maybe join forces. And it's much more efficient and effective than going out alone. So I think those are the kinds of things that experiences I can bring to the board.
Thank you, Diane, and thank you for applying for the position. If you're selected as a board member, what do you think you can bring to the development of a successful long-term strategic plan?
Yes, I think that my budget and fiduciary oversight experience is very important. I have experience public governance and fiduciary oversight at all levels of government, both as a White House Fellow and as Special Assistant to the Secretary of Education, and working with Barbara Bush to develop the National Adult Literacy Initiative. We did it with President Reagan, who wouldn't give us any additional resources. So we had to, we got 34 governors to start their own adult literacy initiatives. And we did a national public service campaign. We got all of the departments of the federal government to look for funds, existing funds that they could redirect to adult literacy. For example, the Head Start program took their funds that were used for parent involvement, and they weren't using those funds. They started a family literacy program in all the Head Start programs around the country, and where the parents would learn and read with their children. So I think those are the kinds of strategic planning things I could bring to the board.
Okay, have you served on any other boards? And if so, please share your experience with us.
Yes, I've served on multiple nonprofit boards. Some of them we've received grants for you all. And I also had the WICHE experience, Western Interstate Commission of Higher Education was one. I also served on several boards when I was a White House Fellow and working with the federal government. And then I also, when I was Vice Chancellor of Oregon University System, I served on several boards to promote technology transfer from the university to the private sector, where they wouldn't take a copyright privilege for half. They would instead get proceeds from the revenues from those technology products. So I served on several boards in Oregon, especially, and for the governor. I also was president of the Oregon Science and Technology Partnership, which was a board that brought business development to the eastern side of Portland, Oregon, and developed initiatives that build the business development for the eastern side.
Great. Thank you for joining us tonight and making time for us and to share a little bit about yourself. I really appreciate that. And you've had a lot of experiences on boards, and the healthcare board is a unique spot. I mean, I think it's a very unique board to serve on, a little different than some of other nonprofit boards, seeing that it's a public entity representing tax dollars funded by our local community. So I'm interested in your view of what it means to be a healthcare director and to serve in that role.
So, excuse me, I think that it is important to consider the board membership as ethical, mission-driven public service. I believe that stewardship of public trust and funds is important, and that commitment to community health and sustainability is important. I also believe in strategic system level thinking and independent non-partisan judgment. So I think that my experiences in my other leadership positions would they would tell you that I serve with ethical leadership and with worrying about sustainability, worrying about outcomes, being sure that we are measuring what we're doing, and with limited resources, being sure that we direct those resources to things that were successful and are ethical.
Thank you for your answer. Next question. Over the next 30 years, the district will receive $650 million in lease revenues from Tenet Healthcare. What is your view of the priorities of how the funds should be used to advance healthcare in Mexico County?
I think that the way that the board has been approaching this is appropriate. It's never easy to do leadership in good times, in bad times, but it's also difficult to do leadership, good leadership in good times. So I think still that there's a need to rely on the data. There's a need to do listening sessions as you've been doing. I would be absolutely involved with the communities so that I knew I was representing what was needed for those communities. And I think that anything that the board funds should be mission driven, data appropriate, and should result from the involvement of the community, both the clients, the partners, and the providers. And that I think you've been doing a good job of that. And I think that should continue.
So there's two questions. I'm going to ask you the first one, give you the opportunity to focus on that, and then ask you the follow-up question, which is related to the first one. Okay. So the first question is, besides the services provided at the hospital, are there other areas of unmet healthcare needs in the community that you believe should be addressed by the district?
Well, I think you are doing a good job of that. I obviously am very, very committed to the vulnerable populations. And I believe that we need to continue to increase the community-based healthcare people get. We do, for example, go to the Cathedral Palms, the elder housing, and do put soaps in our vital signs and all of that with the work there. And I think those are the sorts of things that are out in the community that allow us to do healthcare in where people live and where they act, where they are, as opposed to it. Russell Lucas from the she's a good friend of mine. We have this debate the issue of should you go out into the encampments and find people? Is that really street medicine? Can it be street medicine if you go where they gather? And we mostly go where they gather, where they have lunch, dinner. We work with the United Methodist Church in Indio and go out under the bridge in like 29, and we set up in the dirt with breakfast from the Indio Church, and we do our putting clothing and shoes. And those are the kinds of things I think like to see more of if we can do things out there.
Okay, so this is related to the first question. So, and you talked about the unmet needs throughout the Coachella Valley. How would you address the unmet needs in the Eastern Coachella Valley? Since you are familiar with that area and the work that you do, and you mentioned that, could you please elaborate?
Yes, we work with the University of California, Riverside School of Medicine and Public School of Public Health, Mecca, the Eastern Valley. And what we do, we of course do our regular things, but we've also helped with many of the other things and work with the promontories. Promontories out there are just absolutely fabulous. And we work with them in terms of the value referral to where there's hardly any primary care out in that part of the valley. We have to find those referral sources, and when we need to do referrals, it's very difficult. And then transportation is another issue because once we make a referral, there most people can't get to it. Don't have transportation, so I think that the East Valley really there are some really important things out there. Galleries, for example, is just wonderful, and the UC Riverside School of Medicine. That's also wonderful. It's run by medical students. It's not run by the medical school, and ours is run by our nursing students. So it's a wonderful program. They have all sorts of groups that get together on a Saturday every month, and it's things like that I think should be encouraged. There is no primary care. There's just almost no specialty care for sure, but no primary care. And as I say, transportation is really a big issue.
Thank you for your responses. At this time, we welcome any questions you might have of us and closing comments.
Okay. All right. So it's an interesting process. We feel a little bit like the green room, TV's in there, everybody knows. It's a wonderful group of candidates you have, and we've had a nice time just conversing. But I think that we all are interested in. I would like to stay on if I was selected and run for the position eventually. I don't know if others wanted that. I don't know if you have that as a criterion for this board appointment, but I just want to reassure you I would want that because I would want to have the continuity of work.
Perfect. Well, thank you. Then we're going to go ahead and excuse you. We're going to call Ruth Zimmerman. Yes. And then after we interview Ruth, we're going to go ahead and take a 5-minute break. Ruth, once again, welcome. Thank you for your interest in being a part of the Desert Healthcare District and Foundation Board. We have a set of questions that we'll be asking you. Before that, we're going to allow you some time to introduce yourself and let us know why you'd like to join the board. And then towards the end, we're going to also allow you some time to ask us questions you might have and then for closing comments. All right, so we are going to go ahead and get started. The mic, the floor is all yours.
Thank you. My name is Ruth Zimmerman. I am a registered nurse by background, but I've been working in healthcare and data analytics leadership for quite some time, most of my professional career. I come to this point in my career having taken kind of a circuitous path. I started, of course, in bedside nursing, worked my way into nursing academia, eventually found a knack for data, and I became an informaticist, a clinical informaticist. So making sense of information around healthcare patients and populations, understanding the services and care delivery and how it's provided, understanding how that billing occurs and where it exists within the electronic medical record so that we can create insights from that. That data career took me to payer side. I've worked for health plans. I've been on the provider side for large healthcare organizations. I've worked with academic medical centers doing large improvement initiatives in order to think about the national level and systems implications of population health. Most recently, I've gotten into the healthcare technology world where I'm building population health analytics software so that providers and organizations can make more sense, bring insights, and take action on patient issues. Most recently, in this current role, I oversee a team of around 30 epidemiologists, public health professionals, folks who are in the data as subject matter experts every single day, generating insights for our clients, which are government agencies and life sciences organizations. My passion for data has really come from a place of clinical value and meaning and wanting to impact patient outcomes, but also as a steward of financial resources at the organization I work for now. I own all of the strategic planning. I think about the operational impact and investments that we're making in massive capital investments in software. I'm the person who is setting the tone for how we think about our mission and vision on my team and within my function. I really enjoy stewarding a team of passionate people toward a more holistic view of healthcare data and how we think about it. My personal passion for coming into this room today is number one, putting myself out there and really thinking about how I can benefit my community and how I can contribute. I work from home, and so I don't always get as much interaction with the public as I'd like. So that's certainly one element of this for me personally. But I believe that I can add value. I think I have a unique perspective that I can bring to the board and to this district. And I want to be of service to the public.
Thank you, Ruth, and thanks for applying. So you kind of addressed this pretty much in your opening comments, but talk a little bit more about the experience you have, and I think especially around the data and the analytics and how you see that benefiting the district as well.
Absolutely. So my job, and really I've spent the last 20 years, is helping healthcare leaders of different types of organizations across the entire healthcare ecosystem make sense of their data and use it to make data-driven decisions. Using the evidence around patient care and healthcare delivery is really where my clinical background comes into play. I don't need to be a nurse in my job, it just helps me a lot. And so I think that has been a really interesting combination of skills that I can bring to a public position where I care very much about my community. I care very much about access and equity and ensuring that our investments are made in the most data-driven and evidence-based way possible.
Thank you. If you're selected as a board member, what do you think you can bring to the development of a successful long-term strategic plan?
So for me, it's all about being clear on our goals, clear on how we will measure them and understand if they're working long term, and then really thinking about how do we reevaluate that progress and pivot or iterate on the plan if needed. If we're not getting the intended outcomes, I would think about whatever levers I have at my disposal to try to make that a change or to iterate if possible. So I do believe that is one of the fundamental elements of strategic planning is the ability to reevaluate continuously and ensure that what you're doing makes sense and is achieving the outcomes that you.
Have you served on any other boards? And if so, please share with us your experience.
I have not done any board service. Much of my work and professional life has been in highly regulated, highly compliant industries. My work today is using de-identified healthcare data, which is HIPAA compliant, and I own data governance for my organization. So I certainly have a lot of familiarity with the regulatory statutes and elements that I certainly believe are transferable to the skill set, but I do not have any board service experience.
Great. Excellent background. I really enjoyed looking through your CV. You know, I've been to the DaVita in Colorado. I lived in Pasadena for a while, so I know the Kaiser organization there where you worked. Um, you know, I think being naive to board service, having been a person who's also was that way, I think it gives you a lot of opportunity to be a new set of eyes to something you've never been a part of before. So I don't think that's a disservice to you for not having ever served on a board. So I ask you, you know, having not ever really served on a board and really being involved, you know, very much so in your career, a lot of clinical analytics, you know, how do you see your one role as a district board member, and two, how do you see your role as a representative of your Zone 5 community?
Yeah, I think to your point, I come to this role with independence, and I think a future and forward-thinking perspective that is always needed in any collaborative board type of environment or team environment in general. I work with leaders that are quite impressive and feel that it's humbling and also makes me realize that I have a lot to learn, of course. I would probably come to this with humility and independence and ensure that I am asking questions, listening both to the public and also and the community and my zone, my neighbors, of course, and ensuring that I am also listening to my fellow directors who have a wealth of knowledge and experience both in the community, so regionally and geographically, as well as operationally within the healthcare environment and the ecosystem here.
Thank you.
Thank you for your response. So the next question is, over the next 30 years, the district will receive $650 million in lease revenues from Tenet Healthcare. What is your view of the priorities of how the funds should be used to advance healthcare in the Coachella Valley?
Yeah, I think I have a lot of passion for addressing the social determinants of health or health-related social needs. I know this is a changing demographic. We are evolving as a community. The demographics are changing in both getting younger and older simultaneously, which is an interesting dynamic. We have senior citizens who want to be independent and maintain independence. I think access to healthcare that is equitable for elderly folks as well as families and young students moving to the valley. It's a really amazing time actually to be here, and I see a lot of change even in the short time I've lived here. So.
Okay, I have an assigned question and I have a follow-up question, okay? So my first part is besides the services provided at the hospital, are there other areas of unmet healthcare needs in the community that you believe should be addressed by the district?
Yes, I would say I have a personal observation that there is not a lot of activities and wellness created for professionals, adult professionals who are still in working age, may or may not have children. I speak from experience and observation that everything is happening between 9 to 5, Monday through Friday in the Valley. I would love to have opportunities, and I know that many of my community members would as well, that pertain to working adults who want to be able to participate in wellness activities, whether that's access to fitness and wellness programs, or whether that is the ability to attend doctor's visits in the evenings or on the weekends, which I think is a major access problem here in the Valley as well.
So my follow-up question is, you addressed the general unmet needs of the Coachella Valley, a very good answer that you provided. Are you familiar with the Eastern Coachella Valley? And if so, how would you address the unmet needs in the Eastern Coachella Valley?
So the Eastern Coachella Valley, I think I know what you mean, the Indio and beyond region. I think there's a lot of development happening in that area. It's probably one of our biggest areas of growth. Also, a lot of diversity in cultural backgrounds and different socioeconomic groups are calling it home. I think there's still a retirement community that is spring out there, as well as new lower income housing needs are emerging. How would I think of addressing that? Was that the sure? So I think about addressing the needs of elder citizens as well as families in the same way that I would think about it all throughout the valley, which is that everyone needs to see themselves in their community and have access to quality and equitable care and activities and fitness and wellness options as well. I think housing is going to probably be the number one issue, I would imagine, as we continue to expand and grow into that area.
Well, thank you, Ruth, for your responses. At this time, we welcome any questions you might have of us and closing comments.
I'm sure you've gotten this question before, but I'm so curious what you're looking for and what you think there might be in terms of skill and knowledge gaps that exist on the board today.
Any of my board members would like to answer?
It's kind of like I say, quality of candidates. It's amazing. Obviously somebody that's committed to the valley, the overall health and well-being, really looking at social determinants of health. As you know, we're going through a strategic planning process right now. So someone that has a mindset of how to do that type of planning, but more importantly, as you referenced as well, and other candidates, is the metrics, the goals, the outcomes, and the ability to pivot. I think also to Kimberly's question, and this a big one of mine for the next board member is really an overall 30,000-foot vision on the $650 million. And not just, we're very worried about just too many people coming for grants right away. It's really catering that allocation of dollars to the strategic action plan in a data-driven way.
Yeah. And is it okay for me to comment?
Yeah, sure.
Okay, I think that's really fascinating, and I think a lot about big picture investments that we could make in the valley. I think there's, of course, my personal passion around technology is certainly something that I would want to consider as a big picture, 30,000-foot view piece. It's a transformation that's hitting all of us. It's already here. And certainly, I think being able to think about technology responsibly and government appropriately is another big element that should be considered in it.
Anybody else would like to ask? For me, I'm looking for diversity. As you can see, we're a diverse board from education, background, life experiences. So I know that only makes us a strong board. And so I'm looking forward to, adding to that. Any closing comments on your end?
No, I appreciate your time and thank you for inviting me.
We're going to go ahead and excuse you. We're going to take a 5-minute break. Mr. Espinosa, would you like to inform the other candidates? We'll be back. That's 5 minutes from you. Just kidding. So let's go ahead and do 6:05. Ready? Yes, we can call him in, please.
Yeah.
We won't start yet. We can wait for Chris. Alrighty, we're gonna go ahead and open the meeting again. Back from break. At this time, we're gonna go ahead and take public comments. Do we have any comments? Andrea, public comments?
Raise your hands. Yeah, we'll comment.
Okay. Okay, we do have one here in the room. So we can please move to the podium. Thank you. Got 3 minutes.
Very much.
Good evening, folks. Happy New Year. And really, it's a pleasure to be here and see all the great faces that are going to bring the future forth of our district for health here in the community. My name is Eric Lemus. I come here with several hats. First, I come here as represent county school board member in Madden School. Second, I am also representing Inland Equity Community Land Trust. And third, foremost, I'm a resident of the East Joe Valley and the city of Indio. And one of the priorities that we're looking for in the education system that was brushed on that we feel is going to be a very strong social determinant will be early health education career exploration. And I want to stress that enough because seeing it through our education system, we're having high visual, but also our youth is learning at a more higher rate. And so we definitely want to make sure that we're bringing career exploration as a priority and as a development. I know that some folks spoke about having physicians, stay and retain them. I think that also implementations begins at early childhood. So, secondly, that was also brushed upon was the housing. We feel that still the need for housing is still health, and that's going to be a strong determinant of how folks in the region are receiving health, and also the exploration of new alternative housing focuses and initiatives and collectives. We know that pockets of health, of housing, really do help. These different pockets of special interest in our community, such as seniors, veterans, and migrant and Florida. And then also, I think seeing it myself as a resident of the Eastern Coachella Valley, we know that there's still a very big gap in how the meetings are coming together. And I really want to also make that sure that that's a priority that the district is bringing forth new ideas and bringing how we're convening communities in health and how we're having conversations of public health. There's still not a lot of places I feel, specifically in my city, that are organizing around men's health and things that are important to youth as well too. So with that being said, I just want to give an honor and kudos to all the candidates to put their name in. I know it was very challenging to be up here and show the impact that we're all going to do. So with that, I wish you all good luck. Thank you.
Thank you. Public comments? Seeing none, we're gonna go ahead and open. Do we want to do discussion or do we just go straight for nomination? So what I would like to do is,
And then who's going
yeah,
Keep up nomination. Because, so it's, like, let everybody know.
okay. So at this point, are there any comments, with the board, would the board like to make any comments before I open, for nominations?
I just want to say that you all did fantastic job. And I want to say thank you for what you've done to, address the health of our community. And I think that if I were to choose any one of you, I would be making a good selection because I could not go wrong. So just thank you for stepping forward to apply, and I wish you all the best. And if you are not selected, I still hope that you will still be part of this process because we always need our community members to give us your input and feedback on how we are doing.
I'm just going to echo Letty a little bit. It's an amazing field of candidates. I mean, I think that if I had to be appointed when my seat was open, I would have made a lot of me. I've had the pleasure of working with almost all of you in some capacity or another, and I just agree with Letty. No matter who we get on this board, we're going to be stuck really well, and so was on by. So thank you.
Any comments?
Yeah, I also want to thank all of you for your applications and how you presented yourselves this evening. I think every one of you are so well qualified. It's going to be such a tough decision to make. I wish we had room for all of you to be members of this board, but please be involved with our if you're not selected, please stay involved with the healthcare district and join our committees and give us input in terms of what our future is. We have such an exciting future coming up with this healthcare district.
Thank you. So then, seeing no further comments, discussion, at this time, we are gonna go ahead and open for nominations.
So what is the process?
Would you like me to read the process again? Okay, so the nomination process. So at the end of the interview process, which is now, and following board discussion, I will announce that the nominations for appointment to the board are open. As more than one person may be nominated, nominations shall remain open until all nominations are made by the board members. To ensure that all potential nominators are provided an equal opportunity, I will ask, are there any other nominations? When there are no further nominations, I will indicate that the nominations are closed. Mr. Christensen will distribute individual ballots, and each of the board members will write their selection. In keeping with the requirements of transparency and open voting, the completed ballots will be handed back to Mr. Christensen, whereupon the voted selection of each board member will be read out loud. The paper ballot method will be utilized on the first and any subsequent ballots until one of the nominated candidates obtains at least 4 votes. When one of the candidates achieves 4 votes, I will ask for motion in a second on the appointment resolution and roll call vote. After the resolution is passed, Mr. Scott will administer the oath of office to our new director. So at this time, I would only be asking for names. Are there open for nominations? Would anybody like to nominate?
Are we allowed to do more than one nomination? Okay, thank you.
I would like to nominate Dr. Diane Vines.
I would like to nominate Anise Smith.
I would like to nominate Gary Harris.
I would like to nominate Craig Johnson.
I would like to nominate Ruth Zimmerman. Are there any, and sorry, Director Luxon.
You're good. I believe Greg said Gary Hans.
Are there any other nominations at this time? Seeing no other nominations, then we're going to go ahead and proceed with
And Director Loxton, if you would text me your vote, I'll pass out the hand papers here, but if you would text out, great. Should have the Jeopardy.
Oh, so that is.
Huh?
So that is.
Yeah, more memorized. First I have the one school.
Oh.
You know. Southern Valley for us, so we have one vote for Denise Smith. One for James Higgins. Nominees Denise Smith. For votes for nominee, Denise. Kimberly Barraza, one votes for Rogers votes for Dr. Diane Vines. Vice President Rodriguez votes for Gary Knox. And Director Perezgio votes for Denise Smith. So, oh, sorry, I forgot about Director Logston. And Director Logston votes for Gary Knox. So what do we have?
2 for Gary, 2 for Denise, 1 for Diane, 1 for 3.
So
Okay, so we have to do the no vote then until we get 4, right?
Yep, we would all do it. We got 9 ballots. If we run out of ballots, we'll just make more. Okay, so we'll get it.
So the goal is to think about it and decide if you want to change your vote or stick with who you chose initially. And then the end result is to come out with a total of 4 votes for the same man.
Now, if we were unable to come to a consensus of 4, we can.
no, we will.
Okay. I just understand that we would have to basically run out of the county, and they would probably just set up an election.
Yes, I'm sorry. We can't pick 2.
But I know you're like.
Okay, so I'm going to do Director Loxton first, so I don't forget. Director Loxton votes for Gary Knox. Director Delara votes for Denise Smith. Director Rodriguez votes for Gary Fox. Director Barraza for Denise Smith. Director Perezgio votes for Denise Smith. And Director Rogers votes for Diane Vines.
2 for Gary, 3 for Denise, and 1 for Diane.
So 2 for Gary, 3 for Denise. Round 3. Drum roll.
Director Lofton for a second.
Okay. Director Lofton is consistent. This for your comments. Smith. Director Rodriguez has voted for Anise Smith. And Director Delara has voted for Smith.
So that's 2 for Gary and 4 for Denise.
So we have 4 has voted for Anise Smith. So now we go to the next step, right?
So, yeah, so now if you want to make it unanimous, we have a resolution, we get a motion, and sometimes what, we'd like to make it, basically, we have 4 votes, then we make it unanimous. So that's what we, it's a resolution, that 2601. We get a motion in a second.
So I'll entertain a motion.
For a resolution, for Anise Smith.
It's okay.
Okay, can we go ahead and please have a roll call vote?
Director Rogers.
Yes.
Director Carrasco.
Yes.
Director Lobson.
Yes.
Secretary Delara.
Yes.
Vice President Rodriguez.
Yes.
President Velasquez.
Yes, congratulations. So at this time, we're gonna go ahead and let's see.
So I don't think, right, it's more important than, today, taking the pledge of allegiance to, our oath to our Constitution and so. So with that, I'm going to, ask you to raise your right hand and repeat after me. I do solemnly swear that I will support and defend the Constitution of the United States,
Constitution of the United States.
the Constitution of the State of California,
Constitution of the State of California.
against all enemies,
Against all enemies.
foreign and domestic,
Foreign and domestic.
and that I bear true faith and allegiance
Bear true faith and allegiance.
to the Constitution of the United States
Constitution of the United States.
and the Constitution of the State of California.
The Constitution of the State of California.
And I take this obligation freely,
And I take this obligation freely,
without any mental reservation,
without any reservation or
purpose, or evasion.
consideration.
That I will act office, and that I will well and faithfully
That will
discharge the duties
discharge the duties
upon which you are now.
on which you vow to.
Congratulations.
Thank you.
Okay. To ask you to take a seat, join us, and we're gonna go ahead and take board member comments before we adjourn. Any comments from the board? And
Yes, I just want to welcome you to the board, because I know you'll do a wonderful job.
I also want to welcome you to our firm and look forward to working.
Thank you so much. Thank you for your confidence and your support. And I'm very much looking forward to endeavoring on this journey with you all, getting into the strategic plan and serving the community as best we can. So thank you. And thank you to everybody for being here.
thank you, Director Lawson. I
Yeah,
see your
keep-
hand. Thanks.
I was patiently waiting. It's tough for me. Congratulations. Excited to work with you. Excited to have you part of the team, get into the strategic planning with you. So you're going to represent Zone 5 very well.
Thank you for that. Congratulations once again, welcome, and we're gonna go ahead and adjourn this meeting at 6:25.
you.